Good day, everyone. My name is Emma Koja. I'm a nurse and the cervical cancer screening coordinator of my facility. This month, January 2025, is the month that is globally dedicated to creating awareness on cervical cancer. Cervical cancer is caused by human papilloma virus that has affinity for the neck of the womb, the entrance to the uterus through the vagina. Almost all the cervical cancer cases, 95% to be precise, are linked with infection with the high-risk human papilloma virus, an extremely common virus that is transmitted through sexual contact. The following are the various risk factors that can predispose further, how this human papilloma virus strives to cause cervical cancer. They include early exposure to sex, keeping multiple sexual partners, taking hormonal drugs, family planning to be precise, multiple births, people giving birth more than 5 and above, and others. At that state, it provides an enabling environment for the virus to strive, keep destroying the place silently, and the cancer progresses. There are various modalities to know an individual HPV status. These include 1. Doing pap smear. Pap smear simply implies taking the cervix cell, smear on a slide, and sent to the lab for testing. Secondly, we do visual inspection with acetic acid. This simply implies you inspect the cervix to start with, you dilute the 5% acetic acid appropriately, stained, and watch out for precancer lesion. Perhaps, if it is positive, the individual is treated immediately and followed up. If it turns out negative, fine. The individual is given a year appointment. Now, how to minimize the risk of cervical cancer? This is simple and straightforward. Cervical cancer can be minimized in the following way. Firstly, we ensure we avoid giving out a girl child early for marriage. Also, avoid keeping multiple sexual partners. Thirdly, avoid the use of hormonal pill, which also, of course, enabling the striving of the HPV at that neck of the womb. We are privileged in our nation today that the vaccine has been inculcated in the immunization schedule, which every girl child can access from age 9 to 14 years, which afterwards, when they become sexually active, they will now begin the routine, regular cancer screening from age 21 and above. That goes a long way to curb the spread of cervical cancer. HPV vaccine can be termed terrible. When an individual becomes infected with the high-risk species of HPV, it remains there over the years. It can be there for 10, 15, 20 years, destroying the cervix. Afterwards, the individual begins to feel funny. At that time, the cancer has developed already. Such person will have lower abdominal pain, bleeding in between menstrual flow. When such individual meet with the husband, they have postcoital bleeding. Also, smelling foul discharge from the vagina. Also, they become anemic and very weak. Please don't keep this information to yourself, because as it is, a lot of people in our society today don't know that sexually active female will always avail themselves for routine, regular cervical cancer screening. People present to the hospital very late when it has developed, and at that point it's so pathetic that they are being taken care of palliatively, in pain and all. So we are glad to be part of this trend of creating this awareness. It is said information is power, though it's a potential power when not put in use. Now that we are aware that cervical cancer screening is meant for every sexually active woman, You are kindly encouraged to make yourself available to every nearest diagnostic testing center at your disposal. This information is brought to you by Health Without Borders International. Better health, better living.